Is your face losing its fullness? Would you like to pull some of that skin away in order to see your face shape better? Maybe you think a facelift sounds too invasive. Today I'm going to show you a much simpler method to rejuvenate your face. It's called a Max Facelift, here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on this show we're talking about facelifts, but not just any facelift. We're talking about Max Facelift, a minimally invasive procedure that will leave you looking refreshed and youthful. Let me introduce you to the doctor who will be performing today's facelift, Dr. Thompson. Hey, how are you?
Hi, Troy.
So nice to see you again.
Nice to see you.
Talk to me, what is a Max Facelift?
A Max Facelift is a legitimate facelift, but it's just a little bit less involved than kind of a standard facelift in a lot of ways.
Why did you use the word legitimate facelift?
Because there are a lot of facelifts out there that maybe don't actually lift the face permanently. They might just lift the skin and give a temporary result, and then a year later you're wishing you hadn't done it.
Okay, so Max, M-A-C-S. What do those four letters mean?
It stands for minimal access cranial suspension, and minimal access part means that the incision is short, and cranial suspension means that the muscle layer of the face is actually suspended to a fixed point up here so that it can't drop down.
Is it a relatively new procedure that people are doing now, or?
It's not that new. It was actually developed by a facial plastic surgeon in Belgium who is very well respected, and he's been lecturing at our meetings for many years, and he actually pioneered the technique.
Oh.
And there are a lot of plastic surgeons around the country that use the technique. It's really gained a lot of foothold.
A lot of support behind
Yes.
it as well. How does it differ from a regular facelift, the traditional facelift that everyone out there at home thinks is pulling, cutting and stitching?
Probably the biggest difference between this and a standard facelift is the length of the incision.
Okay.
A standard lift goes in front of the ear and then behind the ear and into the scalp, and the MACSlift ends right at the earlobe. It has that same incision in the front, but it ends at the earlobe. And then the general kind of degree of dissection and work underneath isn't quite as involved as a standard facelift. And also, it's done under a local anesthetic, which means you're completely awake for it.
The whole time?
Right.
Will the Max Facelift give the same result as a traditional facelift?
No, it won't. It will give a substantial result, and it's a great procedure for someone that has early aging, early jowling, early neck laxity.
Okay. How do men look when they're having this done, as opposed to we've seen lots of men have facelifts, the traditional facelift, and they look pulled and stretched on their skin? It looks very unnatural on a man. Is this a great procedure for a male type of a facelift?
It's a great procedure for a male or a female. The big difference is we want to make sure it's someone that doesn't have a really heavy neck or really heavy jowling, because it won't quite do what needs to be done for that patient.
Okay, well thank you for that information, Dr. Thompson. Let's take a look at some of the advantages to having a Max Facelift versus a traditional facelift. When thinking about getting a facelift, there are many things to consider, including which of the many facelift procedures is best for you. There are a lot of benefits to choosing a Max Facelift, the first benefit being that the scar will be shorter. Also, there is less of a recovery period and the cost is much lower than a traditional facelift. Not only will you be back on your feet quicker with more money in your pocket, but the surgery takes less time and is safer than other facelifts because less skin is raised and no general anesthesia is needed. You'll walk out of the office feeling more beautiful more quickly, and after hearing the results, looks so much more natural. What is the recovery like on a MACSlift?
A MACSlift, I tell people, usually about a week to 2 weeks at the most, but usually most people are back at work within a week.
I would assume there's some bruising?
Yes, there's almost always bruising with every single patient, but it's a lot less than a traditional facelift.
Health concerns with a MACSlift versus a traditional facelift?
I would say the MACSlift is a little bit safer procedure because you're not dealing with an anesthetic, and again, I'm not working quite as in depth under the muscle as with a traditional facelift.
You were saying earlier on, Dr. Thompson, that regarding the length of the cut with a traditional facelift. The reason why Max facelifts are so popular now and great success is there's minimal cutting. So would that mean there's less scarring?
Yes, less scarring, meaning a shorter scar. And
Right,
there's still
okay.
a scar, and it's still closed very meticulously to try to avoid visible scarring, but it's shorter.
Downtime, similar to a traditional facelift?
Less, about a week.
That's it?
Yes.
And then you're back at work?
You're back at work in a week, and like I said, you may still have a little bit of bruising. That varies a little bit from one patient to the next, but I've had people that had a facelift in my office come back to work the next day or 2 days later.
That's an incredible result to be able to go back to work within the week, really. If that's
Yes,
what
it
you
really
need to
is,
do.
and as I said, there's always a variation that we have to take into consideration.
course. Coming up after the break, we'll hear a little more from Dr. Thompson. Then we'll head into the operating room to watch him perform what we know is a Max facelift procedure on our patient called Linda. It's giveaway time on The Younger You. You could win a signed copy of my best-selling book, Guide to the Younger You, which takes you on the journey from a healthy soul to a healthy body. Be sure to head over to theyoungeryou.tv/contest to enter. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Before the break, we learned from Dr. Thompson what exactly a Max facelift is. Now we're going to go hear a little bit more about this procedure. Then we'll be headed into his office to meet our patient Linda and find out why she actually wanted this procedure. Now, I've asked you when you've been on the show before about procedures. When you have a Max facelift, do you need to go back in at a later date to have a little bit of a top-up?
Everyone ages at a little different rate, and so a MACSlift is going to turn back the clock so many years, but you will continue to age from that point on, and the rate at which you age varies a little bit from one person to the next. I try not to say anything too specific because every person's a little bit different, but yes, it's most likely we'll want to do some additional procedures in the future.
Are people wanting to just have the Max? And what is your advice on that?
A lot of people come into my office specifically requesting the Max facelift because they don't want the anesthesia, they don't want the longer recovery, they don't want the bruising. And a lot of times I think they're great candidates, but sometimes I tell people I think it would be a mistake to do the MACSlift because you really actually need more than that. After talking to Dr. Thompson, I think it's time we head over to his office and meet our patient Linda.
I'm Linda, and I'm 60 years old. I have 6 children. I've been married 36, almost 37 years. 2 of my children are still at home. I have a 28 years difference between my first child and my last child.
Hi Linda.
Hi.
How are you?
Very good.
You ready to do this?
Yes, I am. Having this MACSlift is kind of a major birthday present for myself. Since I still do have 2 younger children at home, I'm involved with schools. I work with moms who are probably younger than my eldest daughter's age. I just want to be perked up a little, cleaned up a little, not changed.
So just to review a little bit, this is the MACSlift. It's a short scar facelift. It's a little less invasive than maybe a typical standard facelift, and you're really an ideal candidate for this procedure because as we've talked about before, you have kind of early jowling, you don't have a really heavy jowl, you don't have a heavy neck. Everything that you have is kind of early, and so this type of procedure is ideally suited for you. We also have the benefit that you don't have to go under anesthesia, and it should be a quicker and easier recovery as well.
The cosmetic procedures that I've played with in the past has just been Botox around my eyes, a little bit of filler here on my face, but nothing much more than I just considered a fun afternoon.
I'll make the incisions that we talked about before. It'll go under your hairline here and in front of your ear, down to your earlobe. And then I'll lift the skin up underneath here so that I can access the deeper muscle, which is where the strength of this lift comes in. And I'll put some sutures to hold that up, and you know, you'll just be kind of sitting there with your head to the side, and if you feel any pain or anything that's uncomfortable, then you can just let me know during the procedure. So the next step that we're going to do now is I'm going to make some markings on your face for a few things. Part of it is where I'm going to make the incisions. Part of it is the area that I'll be working. Sometimes I mark some nerves that I need to be aware of. So Linda, this incision in front of your ear kind of goes in a zigzag direction, and that'll actually help to take up a little bit of the excess skin when I'm re-draping.
The only type of resurfacing that I've tried is facials, of course, which most women consider really relaxing.
Okay, Linda, what I'm going to do now is put some local anesthetic in your cheek here on the left side, and that should make everything numb. You're tough, you don't even flinch. This pulls a little bit, but it'll just help keep your hair out of the way and help keep me from cutting any of it. And then away from me a little bit. Linda, I'm putting this liposuction cannula in under your neck, and this is where I'll just slide it back and forth to remove some of the fat, and also in your case more it's to just loosen up the skin a little bit. And sometimes I'll get a little bit of resistance and have to work through that. You doing okay?
Yeah.
You don't have a lot of excess fat, and so we don't need to do very much here, but it still serves the purpose of loosening up some of this neck skin a little bit, and that will facilitate our lift.
Coming up after the break, we'll watch the conclusion of Linda's Max Facelift. Then I'm inviting her into the studio so we can see her final results. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Be sure to check out the Younger You website to watch full episodes of the show. Stay up to date on the Younger You Challenge and get useful tips and tricks to help you achieve the Younger You. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Before the break, we met Linda and heard her reasons for getting a Max Facelift. Right now, we'll watch the conclusion of her procedure. Then I'm bringing her into the studio and we can see just how worth it her results are.
Okay, let me know if you feel any pain, Linda. Are you okay so far?
Yes.
Okay, excellent. I'm kind of just freeing up the skin right now and exposing the area where I want to put the stitch. How are you, Linda?
Good.
Good.
I can't think of anything I'm really nervous of except just getting it done and enjoying it down the line. It's not that I've waited a long time to have this done, but it's been in my head and my thoughts for a couple of years. I've been planning. So here I am, and I'm ready, and I can't wait to see the results.
No pain, right?
The only reason I decided to have a MACSlift and not go in for a full facelift or more is I only wanted just to be cleaned up a little around the areas, muscles that had fallen a little bit. And I wanted to do it now instead of 10 years from now. Why wait? If I'm noticing it now, this was the time to have it done.
We've lifted up the skin flap now, and now we'll be placing the stitch down in the muscle. And I'm going to make a little pocket to place that. Yeah, it doesn't take very long to lift up the skin flap. Just sewing everything back together is probably what is the most time-consuming step.
I'm happy to see that some of the magazines that I do read are starting to come out with more realistic women. I wouldn't turn back the clock and be 20 years younger now for anything. I enjoy my life. You know, I want all women at all ages to enjoy their lives.
This stitch is going to pull up the neck muscle down here, and When I go like this, we can see the laxity, and that's going to help to lift up that jowl and the neck muscle.
I think society is really lightening up and enriching with the idea that people can also lighten their own spirits physically with procedures. We all go to gyms, we all watch our weight. This is to also help, you know, with your inner self and how you feel about yourself.
So we've placed the neck suture that will hold the platysma muscle, which is the neck muscle, up, and now we're going to place the lower face jowl suture in, and that will hold the jowl in the lower face area, lift that up. You can see when I pull on this, that tension will pull the jowl, the lower face area up. And that's where this suture is going to be placed now, in that tissue.
Well, I have the whole support of my family. They think it's a great idea. It's something the family's been giggling about and talking about. So they're all anxious to see a new and revised and a fresher me too.
So there are a couple little tiny vessels that are bleeding. I'm just cauterizing those, and then we'll go to your other side to numb that side up, and then I'll come back and stitch this side up. And then we'll be done with this side. The stitches have been placed into the platysma and the SMAS, which are the deep layers under the skin. And now we can see, even with the skin just sitting lax, there's all this excess skin with no tension on it. And so that's why you know, it's so important to lift the muscle. We don't want a lot of tension on the skin. And so now we're going to go ahead and excise the excess skin and stitch everything up.
I think it's much more acceptable than it used to be also. You don't have to go away to a spa for the weekend to have your face tipped up here or there. You know, stay in your neighborhood and have it done and enjoy, show your friends.
We've removed the upper portion of the skin, and now we're just going to remove the portion in front of your ear, Linda, and it'll be all stitched up. So this part in front of the ear needs to be closed so that there's no tension on the skin, and then it will keep the shape of the ear normal, and that's what we're doing right now. Okay, good, Linda. We're all done with this side, okay? Now we're going to go work on the other side and do the same thing.
We've talked to the doctor, seen the procedure. Now we just need to bring Linda into the studio and see if she's happy with the results. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. It's giveaway time on The Younger You. You could win a signed copy of my best-selling book, Guide to the Younger You, which takes you on the journey from a healthy soul to a healthy body. Be sure to head over to theyoungeryou.tv/contest to enter. Welcome back. Before the break, we watched Linda have a Max facelift. This procedure is a minimally invasive facelift that gives you the best results without intensive scarring. Let's head into the studio to see how Linda looks. I'm in the studio with Dr. Thompson and Linda to talk about her Max facelift procedure. But first, let's take a look at Linda's before pictures. Linda, talk to me about what you see right there.
I was just getting up in the morning after a good night's sleep and looking tired.
Yeah.
And I wasn't tired, but it was starting to show.
As in you felt age was creeping in?
Yes, yes. But, you know, I just wanted to perk up a little bit, clean up a little bit.
I have to say, you look stunning.
Thank you.
You really do.
I feel really good.
Dr. Thompson, why the Max facelift?
Well, for Linda, she's a great candidate for the Max facelift because she didn't have a really heavy full neck. She had some mild jowling starting, and she really wanted something that she could do in the office and have minimal downtime.
Do you mind if I ask you how old you are, Linda?
I'll be 61 next month.
You look incredible. Why the MACSlift for you? Why not the traditional facelift?
I'm starting to have just a little bit of jowls, you know, and I thought, well, you know, maybe someday. And I thought, why someday? Why not now so I don't have to live with it for another 5 years or so? Now.
Dr. Thompson, how long does it take to see the results? Is it immediate after the swelling?
It's immediate. There is some swelling and some bruising, but you can see the result through all of that.
You were awake. You only had a local anesthetic.
Yes.
Were you scared?
No, I really wasn't, and I was relaxed, and it was very professional. Very
You felt nothing.
I felt nothing.
Dr. Thompson, why do you only use a local and not a general?
If we can do something and not use general anesthesia, it's safer for the patient, it's easier for them, it's easier to wake up.
Linda, I want to ask you, when you told your husband and your kids, they don't hear Max, they hear facelift. What were their thoughts and their concerns to you?
They were afraid there was going to be a lot of downtime. They were afraid that I was going to come out looking like someone else. But once, you know, once they saw how easily I went through it, I mean, my husband drove me, he waited, he drove me home, and that was it.
What have your friends actually thought of you having this procedure?
Not much. It was kind of like, you know, oh, you look nice today. And I'm like, yes, I shaved the mustache or need glasses, you know, or ditched the glasses. They really didn't know. I mean, the people that didn't know, they didn't know.
Now that is interesting. Is it because a Max facelift is nowhere near as invasive as a traditional facelift?
That's part of it, and then the other part of it is it's not a dramatic change. It's for someone that has the start of really heavy aging face. And if you look at the before and afters, you can see that there's definitely a significant difference, but you could imagine that a person wouldn't really notice.
Linda, when you see your results now, do you still feel that age?
It's not that much different. It's like I got new makeup, maybe, or you know, I've just been working on my skin, but it doesn't feel tight at all, but it feels better, and I like my jawline so much more better now.
Yeah.
Yeah, and I mean, her jawline is one of her greatest features, and that's what she was starting to lose with this coming forward. And now, if I pull on this, there's just no jowl, and that's really what it corrected.
What do you say to women watching you right now who say, oh, she's just done it because she's vain?
Oh, that was a big struggle with me. I didn't want to be vain. I just wanted something to for my spirit. There's got to be a little bit of vanity in it.
Well, Linda, I also believe, and Dr. Thompson, that we all have a little bit of vanity. If we didn't, we wouldn't be cutting our hair, we wouldn't be brushing our teeth, and that's okay to have, because I think it's always putting your best foot forward.
And not only that, the impression that we present to everyone else is so important, and
It is.
we're judged, and we judge others based on the appearance.
Oh, well, I don't judge anyone, Dr. Thompson.
Not even in a bad way, you know?
Yeah. Do you feel people look at you now and judge you because of this?
Maybe a few, maybe probably the few that are afraid to see what it entails, because people do ask me, you know, did it hurt? Does it still hurt? You
People
know,
are fascinated,
but you know, I didn't disappear from my normal daily life.
Which I love.
Was there. So, like I said, a lot of people who don't know don't even realize it. They just know that I look refreshed.
Well, Linda, I have to say thank you, because I think everyone at home is looking at you and going, what an incredibly beautiful looking woman you really are.
Thank you.
And yes, I'm so happy you did it, because now you feel just as young on the outside as you do on the inside. Dr. Thompson, thank you for sharing with us again today. We really appreciate it. If you at home are interested in lifting your face just a little, but have been looking for a less invasive method than a traditional facelift, perhaps a MACSlift is the right procedure for you. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week. Next week on The Younger You, a 41-year-old woman who wants to get rid of her stubborn acne scars. The Younger You set provided by Madison McCord Interiors.